I'd like to introduce Dr. Jaume Sauleda, a renowned chest physician working in Espases Hospital, and now he's going to speak about bronchoscopy.
Good afternoon. The bronchoscopy is an endoscopic technique that allows the visualization of the bronchial tree, introducing a tube by the mouth or nose, mainly by nose, called bronchoscope. It has been used from the 19th century and developed in the 60s, and mainly in the last 15 years. The bronchoscope is connected to a light source and a video processor that allows to visualize the visualization of the images in a screen. The main indications are for diagnostic and for treatment of respiratory diseases. There are two types of bronchoscopes, the flexibles and the rigid. The former consists in a flexible tube about 5-6 millimeters of diameter and 60 centimeters of length, and we use this procedure with local anesthesia and some sedation. I forgot that this tube has a small video camera at the end, or in the tip of the bronchoscope. The bronchoscope has a working channel, ranging from 2 to 3 millimeters, that we can introduce in this channel some tools, and we can aspirate respiratory secretions. The tools that we can introduce are, for instance, forceps biopsy, needles, proofs, catheters, and so on, that allows to obtain cells, tissue samples, respiratory secretions, and we can analyze them to diagnose or to treat airway obstruction. The main indication of this technique is the lung tumors and respiratory infections, and as I told before, to treat some airway obstruction. The second type of bronchoscope is the rigid one, and it consists is a metallic tube about 10 to 15 millimeters of diameter, granting the introduction through it of bigger forceps, bigger proofs, and its main indication is for to treat the bronchial tumors, but to permeabilize or to the permeabilization of the airway. The procedure, we do this procedure in the operating theaters with general anesthesia. In summary, the bronchoscopy is a very important technique, it's a very relevant technique, because we can, with this minimal invasive technique, we can diagnose and treat very relevant respiratory diseases. It has been grown exponentially last years, and I think it will grow again next years, and perhaps it could be a very interesting option for the residents. That's all. Thank you very much.
Thank you very much, Jaume. It was a very, very interesting talk, and thank you very much, everybody.